this year, the LYSA group published the LYSA guidelines for primary mediastinal B-cell lymphoma in European Journal of Cancer. It was a very collaborative work of the LYSA group, more than 40 experts, pathologists, molecular biologists, also PET scan experts and clinicians have worked together to cover all the features of the primary mediastinal B-cell lymphoma diagnosis, follow-up and treatment. And one of the main challenge is the diagnosis pathway, because it's a hard to diagnose lymphoma, hard to biopsy anatomical site, the mediastinum, and we observe that there is difficulties for the pathologist to identify with only the biopsy the diagnosis of primary mediastinal B-cell lymphoma. So we suggest to add a molecular testing, a molecular genotyping for all cases of suspicion of primary mediastinal B-cell lymphoma, because there is a specific genotype landscape, mutational landscape that is very useful to confirm the diagnosis of primary mediastinal lymphoma. So we suggest that the pathologist can do first pathology report with probably this is a primary mediastinal lymphoma, but then to confirm with molecular testing with either next generation sequencing or gene expression profiling to be certain, absolutely sure of the diagnosis of PMBL, because the consequences for the patient are important. The treatment is a little bit different, with a dose intensity that is very important for primary mediastinal B-cell lymphoma, and this is different from DLBCL, for example. So the dose intensity, the treatment at the first line is quite different. So it's important to know if this is a PMBL or just a DLBCL with a secondary mediastinal involvement, because you will not treat the patient the same way. And also in the relapse setting, the PMBL is very sensitive to checkpoint inhibitor and anti-PD-1 antibodies, so it's very important to do a rebiopsy again when there is a suspicion of relapse, and to be sure that this is still a PMBL histology, and so you can decide between CAR T-cell and anti-PD-1 checkpoint inhibitor in the relapse setting.